hypoglycemia is when the glucose level is less in the body. How do you know one is having hypoglycemia? When you check the glucose level and it is less than 70 milligram per dl, or is less than 3.8 millimole per liter, depending on your hospital setting. Some hospitals use millimole per liter, while some use milligram per dl. So assuming you have 70 as your milligram per dl and you want to convert it to millimole, you just use 70 divided by 18. And assuming you have 3.8 as your millimole and you want to convert it to milligram, you use 3.8 multiplied by 18, meaning 18 is a constant. So what causes somebody to go into hypoglycemia? Here are the main causes. Someone that is starving, they have not eaten for a long period of time. Someone that has a tumor that causes hyper secretion of insulin. Someone that is on medications that reduces the glucose level. And someone that is exercising too can have hypoglycemia because glucose is in use. Now, let's look at the signs of hypoglycemia. Just the same way you feel hungry is the same way hypoglycemia occurs. Because first of all, you start with sweating. Immediately you start with sweating. After not eating for a long period of time, you start sweating. You start having blurred vision. You can't see well. You start having, you're confused. All of a sudden, you feel you're not comprehending what people are saying. You suddenly collapse. You fall down on the floor and collapse. You went into unconsciousness. Some go into deep coma. And the last thing is death. That's if management is not given. So how to manage a patient that has hypoglycemia? It comes in two ways: for a conscious patient and for an unconscious patient. For a conscious patient, you advise the patient to take what? Oral glucose containing fluid. You can give a cube of sugar, you can give Coke, you can give Fanta, any drink or food that is available that contains carbohydrate, that contains glucose, you give to the patient. Then for an unconscious patient, depending on how severe the patient is, you either use a glucose containing fluid like 50% dextrose or 10% dextrose, depending on how severe your patient is. So for someone that is deeply comatose due to hypoglycemia, you give 50%. And sometimes, mostly children present with convulsion. I advise people not to give diazepam first. I always advise them, check your glucose level before administering diazepam in a convulsing patient. Why? Because low glucose level can also cause convulsion. So when you give diazepam first, before later confirming that the sugar level was low, it will delay the process of your patient resuming to consciousness. So you check the glucose level before administering diazepam in cases of convulsion. That's that. So in an unconscious patient, okay, after giving the glucose, what do you expect? You expect that the patient should continue feeding or a maintenance dose of glucose to prevent rebound hypoglycemia. What is rebound hypoglycemia? This hypoglycemia occurs because after introducing a glucose containing fluid to your patient, the body is trying to mop it out so that it will not develop hyperglycemia. So if you do not give other glucose containing fluid, or you do not introduce other small glucose following the first dose of glucose you give, the body will tend to mop out all the glucose you give, and this patient will go back to a second phase of hypoglycemia, which is known as rebound hypoglycemia. So after administration of glucose, you check the glucose level within 15 minutes. As simple as that. Thank you.